Hello, everyone. I bring you warm greetings once again from KM Dental College and Hospital, Sumandeep Vidyapeeth, Vadodara. My topic for this conference is evidence-based research and ethics. So before we go to what is evidence-based research, quickly, what is research? We all know it's a process to discover new knowledge, and it is slightly different than other forms of discovering knowledge, like reading a book. How is it different? It is a systematic inquiry, right? Which investigates hypotheses. It also suggests interpretations of the data that is collected, and it also paves way for new questions which can be taken up for research in future, right? And the objective of any research is what? To extend the existing human knowledge of physical, biological, and social world beyond what is already known today, right? We do research to go beyond the existing knowledge, right? Now, the process of research is a very systematic, and it uses a scientific method. Now, what is this method? We read a book, we read articles, we find gaps in that articles. From that articles, we make certain observations. Based on the observations, uh, we form a research question. Now, based on our research question, we search the literature, we compile the literature, and we frame a hypothesis of related to our research question. And we conduct experiment in line with our hypothesis through the in the collected data through the experiments, the data that we've collected. We analyze that data, interpret that data, draw results and conclusions from the data. And then what do? We share the results through publications to the community, right? We don't want our data to go waste. Now, these results might help to develop new interventions for diseases. They might even contribute to refining already existing interventions, or they might pave way for new research questions. So this is the scientific method of conducting a research. So what is evidence-based research then? We already know this is research. Evidence-based research is slightly different in the sense that it uses prior research in a systematic and transparent manner and forms a new study or a new research question which will answer relevant questions in a valid, efficient, and accessible manner. The results which will be obtained will be valid, efficient, and accessible. In evidence-based research, if you plan systematically, you get more predictable results. Like you have a direction right from study design, right from framing a question as to where you are going. You are narrow in your research, or you narrow down your objectives. So how? So another definition for evidence-based research: a conscientious, explicit, and judicious identification, evaluation, and use of the best evidence that is currently available. In research, we search the existing literature, But in evidence-based research, we explicitly and judiciously identify, evaluate, and use the best available current literature for our research. I hope that's clear. So there's a slightly different scientific method. We call 5 steps of evidence-based research. The 5 A's: ask, acquire, appraise, apply, and assess or evaluate. Right? So let's ask first. What is ask? Ask the question or define the question. Here, we use PICO to define a question. Now, what is PICO? PICO is a mnemonic or an acronym where P stands for population, I stands for intervention, C is for comparison, and O is for outcome. This helps to organize a well-built and answerable question. And T here, either it can be time or type of study design that is used to conduct our research. So when we have developed our PICO question, or when we have defined our question using PICO, searching the relevant medical information becomes far easier for us. Okay. We are dot on, or we pinpoint our requirements. So the searching the literature becomes very easier. Okay. And this is a way of formulating a medical question to match the capabilities of database search engines such as PubMed. So if we have made a very answerable question by using PICO. And this answerable question helps us to use the search engines such as PubMed in a very efficient way, so that we are able to search the literature that is actually relevant to our own PICO question or my own research question. As for example, a very simple example, oral squamous cell carcinoma. Okay, so worst pattern of invasion and perineural invasion are two parameters which help to predict cervical lymph node metastasis in patients with oral squamous cell carcinoma. So my research question is, which of the two better predicts cervical lymph node metastasis in patients with oral squamous cell carcinoma in observational study? So what is my PICO here? My population is patients with oral squamous cell carcinoma. My intervention is perineural invasion, identifying perineural invasion to compare with worst pattern of invasion, and the outcome is predict cervical lymph node metastasis. Okay, this is a very simple example. PICO needs a lot of discussion how to form PICO for different kinds of studies that you are doing. If you have a clinical trial, if you have a diagnostic study, if you have a prognostic study, how do you form a PICO? It's a very long session. Maybe, this is just an overview of what a PICO is as related to evidence-based research. I have a very clear answerable question. So with this answerable question, what next I do? I acquire evidence. What do? I search for the best evidence. Now, how do I do that? The 4S approach to finding the best evidence related to my PICO question. This is the evidence pyramid. We start from the highest level of whenever we do a search. We use search engines, we use mesh terms, booleans, and filters to do the search. So we start from searching from highest level of evidence. As we do not find the highest level, we go to the lower levels of evidence. That's how we conduct our literature search in evidence-based research. We go from the highest level of evidence to the lower level of evidence. The base of the pyramid consists of lowest level of evidences, and the peak consists of the highest level of evidences. The second category of evidence pyramid, where you find systematic reviews and meta-analysis to be the highest level of evidences, and expert opinion, case control studies, case series reports to be at the lower end. It's not that they are not good level of evidences, but yes, when we do literature search, the highest level of evidence that we can rely on are the systematic reviews and meta-analysis, critically appraised articles, and so forth, right? The upper level of pyramid is the filtered information. The lower level is unfiltered information. And we use databases and search engines to search for all these different type of studies related to our PICO question. Next step, what do? We appraise the evidence. Okay, we do not blindly apply the evidence that we have found into our study. We critically appraise the literature that we have acquired. The articles, we do critical appraisal of the articles and then decide which is the best one to use, or which is the best methodology which I can use in my clinical setting or my research setting to get equally answerable results. Okay. So what is critical appraisal? Critical appraisal is a systematic processes through which we identify the strengths and weaknesses of a research article. And this is needed. Why? Because we need to assess the usefulness and validity of the findings of that research. We cannot blindly, and actually we should not blindly use any research findings from any research articles and put to use in our research. It is always good to do a critical appraisal to find the strengths and weakness and assess the validity of the findings before applying them in our research setting. Right? Now, the most important components of a critical appraisal are evaluating the appropriateness of the study design, whether the study design is appropriate to the research question that has been asked in that particular, or that is written in that article, right? Appropriateness of the study design, and whether the methodology is appropriate to the study design. These are the key points of any critical appraisal. Okay. And once we find out the strengths and weaknesses of an article, we assess the usefulness and validity, and then we decide which methodology or best methodology to adopt in our research settings. Right? So the critical appraisal, there are a lot of critical appraisal tools which are available on the net. And there are different critical appraisal tools for different kinds of study designs, which you can use to critically appraise a research article which you come across, right? The most commonly used are the CEBM checklist, that is Center for Evidence-Based Medicine checklist. And they have provided checklists for all different kinds of studies, a diagnostic, laboratory study, randomized clinical trials, epidemiological study, and so forth. Another one is the Critical Appraisal Skill Program, CASP checklist. They have also provided all different kinds of checklists for individual study designs, which anyone can use for critically appraising their research article. Okay. So after critically appraising the acquired literature, we have asked the question, we have acquired the evidence, we have critically appraised the evidence. Now we apply the best evidence out of all this acquired into our research settings. The best methodology, the best research design applicable or which we can adopt for our research. These A's are also used in day-to-day clinical practice, which is known as evidence-based practice. And they are used very commonly for day-to-day patient treatment, making patient treatment decisions in patient treatment. And that is known as evidence-based practice. So applying the evidence is the fourth step. And what is the fifth step? Assess or evaluate the effectiveness of steps 1 to 4 by conducting our research, whether it has answered our research question which we have developed through PICO or not, in the way we wish it to answer. I mean, we designed an answerable question, and whether the entire process has answered the research question or not. Right? So these are the 5 steps of evidence-based research, the 5 A's in evidence-based research. So we go to ethics. Ethics in research. Very important to understand. Research and ethics always go hand in hand. One can't be done without the other. So the dictionary meaning of what is ethics? Morals, principles, honor, what is right, what is wrong, fairness, responsibility, right? A lot of definitions of ethics. To put it simply, it is nothing but moral principles of right and wrong. Is it? Yeah. So ethics is nothing but moral principles of what is right and wrong. They are never absolute. Absolute in the sense that they might vary by person, place, and time. What is right for one person may be wrong for that person at that particular point of time. So ethics are not absolute at any point of time. Right? So what is ethics in research? Now, research by and large is a self-regulating, self-policing process in which the researchers conduct and present their research without falsification and fabrication, and give due credit to other researchers for their ideas, and whenever the credit is due. That is the major part of ethics. To conduct in a fair manner without fabricating or falsifications, and to give credit wherever it is due. That is ethics in research. One part of ethics in research. The integrity of any research rests on honesty and trust. That's obvious. It includes use of honest and verifiable methods, right from proposal to evaluating the research, reporting the research results in an ethical manner, adhering to the rules, regulations, and guidelines, and during the entire process, following the professional codes and norms. Okay. Research ethics should also conform or follow the professional code of ethics. We cannot deny or separate professional code of ethics while conducting research. So three main milestones or stones on which research integrity lies. Three broad objectives, one of any research ethics. One is at any time, at all the times, protecting human participants who are participating in your research. Second, research should be conducted in a way that it serves the purpose or serves the interests of the individual society, groups or society as a whole. And the third is the ethical soundness of the research, whether there has been management of the risk, protection of the participants, protection of confidentiality of the participants, and whether the process of informed consent has been followed or not. The most common research ethic issues: research misconduct, authorship issues, peer review issues in peer review, conflicts of interest, issues in data management, and most importantly, there are ethical issues when research involves human participants. So let's see one by one. What is research misconduct? Research misconduct is either the one that distorts the scientific knowledge or the one that misleads the scientific community. Okay, the one that distorts the scientific knowledge is fabrication or falsification, and one that misleads is plagiarism and authorship. There can be duplicate publication, publishing in 2-3 journals the same article, being published in 2-3 different journals, and of course, abuse of peer review process. I know somebody who can review my research or my publication so as to accept it. Okay, so abuse of the peer review process. So what is plagiarism? Copy paste. To put it simply, it's passing off somebody else's work or original idea or original research as your own. Okay, that's plagiarism. So it's an entire spectrum. One end of the spectrum is intentionally copying somebody else's work into your part or whole into your own publication, to unintentionally copying from somebody else's work, right? So without citing or giving due credit to that publication. So one way is intentionally copying, the other end of the spectrum is unintentionally doing it without citing or giving due credit. So we always say that it should be written in your own words and cited properly. Whenever you're writing, you should cite, give due credit to the other researcher. We should all mind that plagiarism is illegal and also punishable. It is considered at par with stealing. It's as good as stealing. So that's one ethical issue in research misconduct. One of the ethical issues, authorship. The International Committee of Medical Journal Editors have given recommendations on which a person can become an author. Substantial contributions, drafting of the work, agreement to be accountable for the entire work to drafting and conducting and drafting at all points of time. Okay, they have recommended this. So the most common unethical authorship practices are honorary or gift authorships. Certain we can't deny. Guest authorship. goes to authorship, right? These are certain ethical issues where authorship practices are done, right? You pat my back, I pat yours. Very common in authorship, okay? You write my name in your publication, I write yours in mine. Of course, that's unethical, okay? Conflict of interest, that's the next ethical issue. It is basically a set of conditions in which your professional judgment is influenced by a secondary interest. Okay. Your professional judgment for a primary interest. My primary interest is what? Always the patient's welfare and proper conducting. The validity of research is my primary interest when I'm conducting a research. But if that is influenced by a secondary interest, that becomes conflict of interest. Conflict of interest can be any, like there are a lot of different sources of conflict of interest: financial gain, professional gain, personal gain, or I can have a prejudice against a certain research, and that brings in conflict of interest. Okay, like any publication you write, we all must have come across. They always have that certificate declaration of conflict of interest, right? So the sources can be any one of these. The conflict of interest is another ethical issue in research. Data management. Data management is mainly concerned with confidentiality, integrity, and availability of the data, right? 3 issues: ethical and truthful collection of reliable data. Who is going to be the owner and responsible person for the collected data? And the third is, how is the data going to be retained and shared with colleagues or with public, right? Now, a clear, responsible, ethically sound, and carefully outlined data management should be made at the start of the research so as to avoid all these ethical issues, right? So, right in the beginning, when we're planning the research, very clear outline on how that data is going to be managed later on should be written down in the research to avoid ethical issues. There are data protection acts for research in different countries. India till date doesn't have in place a foolproof data protection act. But yes, as far as research is concerned, but most of the countries do have in place, and they do have penalties if data management guidelines are breached or the code of conduct is breached, right? So next we come to the ethics in research, which involves human participants. Ethics. Why ethics is important when human participants are concerned. To be able to appreciate the importance of ethics in research involving human participants, let's go back a little in the peep into the history of how research was conducted earlier. After the World War II, certain Nazi physicians or doctors, they conducted researches or they conducted studies, trials on the prisoners or the concentration camp inmates that were there in different concentration camps. They conducted researches on those participants. Very, very cruel researches or very cruel studies that they did. I just name one here, One of the studies that they conducted was, they put the prisoner in ice cold water just to observe how long a person survives in ice cold water, right? So those researches or those studies created a lot of ruckus, and then these physicians were tried in a court. Now, in 1947, as a result of these trials on these physicians, which is very famously known as Nuremberg trials. After the trials got over, came the Nuremberg Code. After these trials were done and lot of deliberations, Nuremberg Code was given. 10 commandments or 10 principles for ethical conduct of research involving human participants were first drafted or first presented as Nuremberg Code in 1947. They were important for researches to be conducted henceforth. What all should be considered? Now, this Nuremberg Code is available on the website. I'll just take you through the important principles or ethical principles that came into picture from after 1947 or from 1947 onwards. After that, the World Medical Association in the year 1964 released the Helsinki Declaration, which contained the ethical guidelines for research on human subjects. And they insisted on any research that is conducted to be conducted in a fair manner. Okay. And they highlighted on the importance of informed consent. The Declaration of Helsinki is regularly updated. The ethical principles are also regularly updated. The third important here is, in the year 1932, the US Public Health Services, they appointed the Tuskegee Institute to conduct trials on Negro males who were suffering from syphilis. Now, what they did was, they recruited the Negro males who were suffering from syphilis just to study the natural history of syphilis. How long these subjects live, what all happens during the course of syphilis. Now, an interesting part is, penicillin, which was then the drug of choice for treating syphilis, were already available in the market. But these patients who had contacted syphilis were not given that medicine. And of course, they were not aware that this kind of medicine ever existed. So after that, in the year 1974, a committee was set up, National Commission for Protection of Human Subjects of Biomedical and Behavioral Research. And it gave the National Research Act. And this National Research Act established a commission which presented the Belmont report in the year 1979. And the Belmont report again emphasized on informed consent and the process of informed consent. And what it further emphasized was 3 elements should be always be included and on in any informed consent: information, comprehension, and voluntariness. Now, what these 3 elements are, as we go further, we'll look into this. But time and again, in spite of the ethical guidelines coming into picture, new and new guidelines being implemented, unethical research continued. Then came the Council for International Organization of Medical Science came up with new other set of ethical guidelines conducting research in the year 1993. In the year 2005, UNESCO gave the Universal Declaration on Bioethics and Human Rights, in which it also laid down the ethical principles for conducting research involving human participants as a part of that declaration. Now, it is important to understand here that India is a multicultural country, okay? And it has multiple healthcare systems with varying standards of care given. So to apply all these universal code of ethics or ethical principles for research is very difficult in a country like India. It becomes problematic. So in the year 1980, Indian Council of Medical Research brought out a policy statement on ethical considerations involving research on human subjects in the Indian subcontinent. And this policy statement is being updated very regularly. And the most recent one was in the year 2017. This policy statement is now known as ICMR code, and it consists mainly of 2 parts. The first part is the statement of general principles on research, which involves human participants. General principles for all the research which involves human participants. And specific is a statement for specific principles for specific research. Say, for example, research on genetic material or genetic studies, or research involving fetuses for that matter. So for that, it has laid down specific principles, specific set of ethical principles to be followed when we conduct research on fetuses. We can't just do genetic studies, or we can't just do studies on fetuses, stillborn fetuses. Even stillborn fetuses. There are laid down guidelines which we need to follow, specific to specific kind of research, right? So now if we look at the ethical principles in research involving human participants, broadly categorized as integrity, respect for persons, which includes autonomy, beneficence, and no harm or non-maleficence, informed consent, scientific adequacy, justice, privacy, and confidentiality. These are the overarching principles, ethical principles, which any researcher should look at when conducting research involving human participants. So what is integrity? Integrity means that the researcher is committed to search knowledge through using highest standards of research methods and recognized principles of research conduct. The best available method for conducting that research with a very high standard, and is able to communicate the research results with other researchers, the collaborators, and the scientific community by and large. Integrity of the researcher. Respect for the persons who participate in the research. Respect their autonomy, the benefits, no harm to the participants, and the process of informed consent. That encompasses the respect for persons. What is autonomy? Autonomy is respecting the inherent dignity of all the participants in the research. Okay, we need to respect give time and opportunity which is necessary for a person to make decision whether to participate in the study or not. So we should give respect, we should respect that person's dignity, give appropriate time and opportunity for him or her to make their own decisions. We should give all the relevant and appropriate information for them to decide whether they want to participate or not. And there should be no coercion or no pressure to participate. So this coercion or participation also comes when there are participants with diminished autonomy, or we prefer to call them vulnerable populations. Though there is no pressure, but they are vulnerable in the sense they might not be in a position to refuse to participate in a research. So the vulnerable population or the population with diminished autonomy are all these. So we should be careful, or we should be more protective when it comes to this vulnerable population in our research. Beneficence and non-maleficence. Hippocrates has very rightly said, primum non nocere, which means as to diseases, make a habit of two things: to help or at least do no harm. If you are not able to help, please do not harm. Two rules: do no harm. Second, maximize possible benefits to the participants in your research and minimize the possible risk that they might have while participating in your research. So look at the risk benefit ratio. So how do we do the second part? Usually weighing the risk against the benefits. If the risks are too high against the benefits, either minimize, or if you can't, revise and research your research question. So how do we minimize the risk and maximize the potential benefits? It's always a good idea. It's always a good, intelligent thing to conduct a pilot study or a preliminary small-scale study with a small number of participants. That will help to assess the risk, effectively assess the risk. And second, make your research design or methodology more robust for your final population. Okay, so make a habit of doing a preliminary small-scale research, or we call it a pilot study, to make your final research more robust and a healthy research. Okay, so these three these two, and the third one is the informed consent. What is an informed consent? It is a process. We give a clear, coherent information to the participant in the language understood by the participant about the purpose, the methods, the risks and benefits, the inconvenience that is going to be caused, or the discomforts that that the participant might have while participating in the study, and the possible outcomes of the study. A very clear information should be given in the informed consent to each participant. Also emphasize on the point that the participation is very much voluntary. There is no pressure. Even if the participant or the person decides not to participate in the study, he or she will not be bereaved of his or her own right to appropriate health care. Okay? Without paying any penalty. Now, how do we do this informed consent? We take this informed consent, written informed consent, but we give the information through participant information sheet. And this participant information sheet should be very crystal clear without medical jargons in the language understood by the participant. And once all the information, the participant has got the time to ask questions, opportunity to ask questions, and gets appropriate answers to his questions, then and then only the participant signs the informed consent form and participates in the study. So this is how we respect the persons who are participating in the study. The integrity of the researchers, respect for the participants in the study. Third point is scientific adequacy of the research. Okay, the research must be justifiable. It should contribute to a certain level to the existing knowledge, not just conducted for the sake of it. And the research design, that is the methodology or the research design that is used in the research, should avoid biases in patient selection, collection, data collection, analysis, and interpretation. Avoid bias at all times. And the researcher must have adequate expertise to conduct the research as well as analyze the data. Or should have a team of experts who can contribute to conducting the research. Justice. So what is justice? We ask the question here, are the participants representative of the population intended to benefit from our research? Are we selecting participants from that same population which we intend to benefit from our study? The answer should be yes. Again, we should distribute the risk and benefit equally. Okay. The principles of justice forbid the placement of one group of people at risk to benefit other. We are trying to benefit one set of population, but we are putting at risk some other population for gaining for this population. Shouldn't happen. Second part is equitable subject recruitment. Each person in the population should have equal chance of being a participant. So one of the method of justice is how we recruit participants is lottery method or random allocation. Okay, that's how we do, so that each participant gets equal chance of being a part of that study. We might have 2 groups, 3 groups. So each participant will have an equal chance of getting into any of the groups. Okay, so that is equitable subject recruitment practices. that is important to capture authentic information from the community. Okay, if we are biased in our selection, if we are not just, we might never be able to capture authentic information. And special protection for vulnerable groups when we look at justice. So justice to the participants, respect for the participants, and protecting the privacy and confidentiality of the participants at all points of study till the publication. It is the prime duty of the researcher to safeguard the privacy and confidentiality of each participant in the study. Privacy and confidentiality, maintaining at all times, and also privacy and confidentiality of the data that is collected. So these are 5 overarching principles of ethics in research which involves human participants. So how do we ensure that the research is conducted ethically? So the Drug Controller General of India and the Government of India has mandated that any human research which is conducted, any research which is conducted involving human participants has to be approved by the Institutional Review Board or Institutional Ethics Committee. And that each Institutional Ethics Committee mandatorily has to be registered either with the CGI, CDSCO, and DHR, Department of Health and Research. So the gatekeepers for ethical conduction of any research involving human participants are the Institutional Ethics Committee, which deliberate and keep a regular check on the research at each part when it is conducted. So, at the end, research is a privilege and not a right of an individual. The well-being of the participant is paramount always. These are few additional sources. Thank you for the patient hearing. I also take this opportunity to thank Dr. Gargi, as always, and our entire team for putting up this wonderful international conference and inviting me once again, giving me the honor of presenting in this conference. Thank you very much.